The problem with suicide in nursing. What is up, healthcare squad? Logan here with Healthcare Stress Relief, and in this video we're going to be talking about suicide in healthcare, in particular in nursing. As you may know, the rates for suicide are higher in healthcare providers, and there are many reasons for this, but I'm making this video to spread more awareness because I don't think mental health is talked about enough in healthcare. And the people who are taking care of our sick population, taking care of our family members when they're not doing well, they have higher suicide rates. There's clearly something that needs to be done about this, and there was a specific situation that happened in my life when I was working as a nurse that changed my perspective about living and life. And this happened in October 2019. I walk into work in the ICU and I hear the news that my coworker Brian had committed suicide. And Brian was actually the reason that I started this business to help healthcare professionals manage stress and prevent this really terrible event from occurring, and raising awareness about mental health in healthcare. So stay tuned to the end of the video because this is a topic that has multiple layers, and it's really important to understand these layers in order to help prevent this. I know you may be saying that this would never be you, but this can happen to your coworkers, this can happen to people you love. So stay tuned to the end of the video. Let's dive in. Suicide, an unthinkable thing. Many of us think about suicide and we cringe, we get a really bad feeling, we don't want to talk about it. It's something that many of us could never even imagine. I'm getting chills just thinking about it right now. And this is a conversation I want to open up because it's something that people go through. There's people who are walking on this earth every day that either kill themselves or think about it. And you can search on YouTube all these videos about nurses helping patients with suicide. There are a couple videos about the problem with suicide in nursing. So I have to share this story today in order to bring more awareness about it. And if anyone out there is having issues with their mental health, please reach out to a provider or somebody who you trust, who you can talk to. It's very important to be vulnerable. I know how hard it can be. Actually, I don't even know what you're going through. I can only imagine. But there are people that still care about you. And I do truly believe that every person has a place on earth. And when you get to such a dark place, you can't see that anymore. And sometimes you need to talk to somebody who can help you out. You do have to grab someone's hand. That's really the only way to get out. So I'm making this video talking to you if you are having mental health issues. The tip up here is suicide, right? And most people would probably never do this. But if you go down and trace it back all the way down here, there are many layers that can lead to this event. And I recently received the letter from Brian, his suicide note. An old colleague sent it to me. I will share a little bit of it, not for my own gain, but Brian left this note, and I think it's really important in helping other people. I think that Brian's actions have actually made a huge impact on humanity. Myself, my business would not have even started if it wasn't for him. So I do want to share a little bit of this just to give insight into what he was going through and to help us understand a little bit more of what can really happen. And before I do this, I'll explain a little bit about Brian. So he was a very good nurse. We were working in the ICU together. He was very dialed in. I would call him more structured, especially compared to me, like kind of OCD to a point. Not that that has anything to do with what we're talking about today, but this was his personality. And he was very jaded, like very dark jokes. Him and I got along pretty well. Dark humor. One day he calls the taco truck to order some tacos, and the guy called him boss. He's like, "Thanks for the order, boss." And Brian hangs up the phone, super pissed off. And I was like, "What's wrong?" He's like, "If I'm not writing him a check, he should not be calling me boss." And his whole day was like, built around this one thing that annoyed him. Him and I had a lot of laughs, and I did notice issues with him, but I had never seen anything like this before. I had never really knew what was going to happen. He had a plan the whole time, nobody knew. But when the event did occur, I can't say that we didn't all kind of look at each other and go, oh, it makes sense. And why? Because he was working way too much. He would take vacation off to work more. Very talented musician. He would go work in plays. So he would just kind of fill his life with more work. And I'll go ahead and share with you something that he wrote just so you can understand what he was going through. I didn't realize until after I read the letter, like, how much pain and suffering somebody could actually endure. I thought that in my life I had endured some things, and all of us have trauma, I believe. Many of us have issues from childhood, but I'll just cue you in real quick. So here he's describing an implosion in his life. His world continues to collapse around me like a deck of cards. My chest hurts much of the time, and the left ear never stops screaming. He wrote in this letter that he was depressed. He started taking Wellbutrin, a medication for depression, and he started getting ringing in his left ear. And if you know anything about tinnitus, it's a very terrible disease. You can't fix it really, and many of the people who have it end up committing suicide. I didn't know this. If you are enjoying this video, please give it a share. This is a very important topic that I feel more people need to see, more people need to talk about. And it's a video that I'm trying to open up the dialogue here. So if this resonates with you, the hearing loss in the last 2 years has been dramatic. My gut's still a mess. I've put 20 pounds back on. I'm not sleeping well and I'm just exhausted. I wouldn't be surprised to find out that a brain MRI revealed a small stroke, as I've had a persistent numbness at the back of my tongue ever since having an episode of vertigo and cold sweats at work during an intense work shift some months ago. The new manager appears to be a budding tyrant, ready to throw good nurses under the bus and making a name for herself in meeting department budget goals, regardless of the human cost. To repeat what I texted you earlier, sometimes it just doesn't get better. There's no one to blame. It is what it is. Maybe we take on too many karmic challenges for growth in one life plan and need to hit the reset button. I've been trying to outrun that boulder coming down the mountain as frantically as I can for a very long time, but I can't avoid it anymore. And that's just the tip of the iceberg, but when I read that, it really makes me sad. It makes me very empathetic to the kind of suffering someone can go through. One thing I forgot to mention, he had a lot of instruments in his house, and there was a fire that burned down a lot of the city, and he lost all those instruments. And I remember him telling me at work, when I've spent my whole life accumulating and collecting these things that were my prized possessions and they're just gone in one day. He said something along the lines of like, he just doesn't understand it. It was a sign that I didn't pick up on. I did mention to him, like, take some time off, enjoy yourself more. Tried helping him in whatever way I could at the time with the tools I had, but he was too far gone. And what I really want to emphasize here is, if there was something in between all of these events, some form of Brian being able to see some light and to be able to love himself more and to care for himself more, I do think that he would still be here today. That's my own personal opinion. I'm not a psychiatrist. But what I have seen with my own clients is you can change your reality, and it starts with changing your beliefs. They're very, very hard to change. In my own personal healing journey, I had eczema and depression well before Brian committed this act, and then I ended up leaving and going on a journey of healing. And a lot of this healing required me doing some really, really hard and deep work but the work is totally worth it, because now my mind is clean from the weeds. I'm connected to my body and I'm connected to my spirit. And I think these are the structural things that we don't talk about in society enough, that life is so much more than just work and collecting a paycheck and collecting instruments and buying a house and having a mortgage. There's a lot more to it, and if we don't feed the other elements, if we don't feed our spirit, our spiritual side, everyone has one. Even if you're an atheist, you can still be spiritual. When we become drastically disconnected from this, it can be much easier to get into a very dark place, because there's no hope anymore. You have no hope. And at the end of the day, I look at this whole entire situation with a glass half full, because like I said before, this business, healthcare stress relief, would not have been started without Brian. I'm really sad to see him go, but I have a kind of faith that the universe works in mysterious ways, and I feel like that act that Brian had committed has changed me so much that I'm actually making a bigger impact on the world that I wouldn't be making if this did not occur. So I do think the universe is pretty interesting in that way. And the last point I want to make is with suicide especially, I've heard many people, like religious people, will say you're going to hell, and some people will say, like, they'll really talk crap about someone who commits suicide. I had a friend that used to say anyone who commits suicide is a pussy. Really no empathy with that statement. At the end of the day, the way I kind of see it is there was no control left in Brian's life, and for many of the people who commit suicide. And that final act is like, that's the one thing they can control, that they feel they can control. They can finally make a decision. I've never been suicidal. I don't know what it's like. If you have and you feel like being vulnerable in the comments, please share, because it will allow people to open up more. There are many people who have had suicidal thoughts. There are many people I talk to that have had them. There are many people currently going through it. And I'll put all the resources necessary if you are having these thoughts below in the comments, so you can reach out and get some help. And as always, I'm here to help. Please reach out to me if you need somebody to talk to. If you know anyone who has struggled with their mental health, or you have somebody in your circle who their family member or friend had committed suicide, please give this video a share. It is a very vulnerable topic, and as I said before, I want to open up the doors to conversation about it. Just want to say rest in power, Brian. I really appreciate the time we had together, and your act, as much as I don't understand it some days, I do see the light at the end of the tunnel. And your decision has made me a better person, despite how weird that sounds. So thank you, Brian. If you enjoyed this video, go ahead and check out this video over here on death and dying. This is a topic that's very hard for healthcare professionals, something that we bottle up, our feelings about death and dying. And in this video, I share a story about a patient who died on my watch. So check it out. Enjoy.